Hi, I'm Dr. Elise Day. I'm professor of urology, and this video is about how to safely deflate a Foley catheter balloon in order to remove it safely.
Okay, here we're going to talk about how to safely remove a Foley catheter. And the important things to know are that usually there's a balloon holding the catheter in place. It is sometimes helpful to just know your catheter and look at your catheter and make sure it's a standard catheter, not a pigtail or a Malakoff catheter. But most catheters just have a standard Foley catheter balloon. And so this is the drainage port where people also irrigate in and out, fluid in and out of the catheter, and this is the balloon port. So what you need is, you can use scissors, but I'm going to show you the standard way, which is using a little luer lock syringe or a slip tip syringe, and you have to engage the valve and then you pull the fluid out. Now, it's helpful to know how much fluid was put into the balloon in the first place, because if you only remove part of the fluid and try to pull it out, you can injure the person. So what I like to do is to then get rid of all the fluid in the syringe, re-engage in the valve because you can't see inside, pull again, make sure you have everything, and you can even do it one more time if you need to. And then you can safely remove your catheter. Sometimes the balloon creates little ridges that can hurt your patient, so it's very important to know that you've removed all of the fluid. An alternate technique that you can use if you do not have this syringe is you can just cut the balloon port. Important to cut it here and not here, because you don't want the catheter to be able to slip back into the bladder. So do not cut here. You're going to cut just the balloon port after it parts ways from the drainage port. And then you should see fluid pop out the end here. And once the fluid's done draining, you can remove your catheter safely. Also important to make sure that if you're removing a catheter that there's not a reason it needs to be in. For example, if you are unsure about the physician's orders, about whether it needs to remain in place, always good to check. Thank you.
Those are the basics of what you need to know about the Foley balloon. We would love for you to subscribe, and we have a lot of other videos that are helpful to learn about pelvic health. Thank you.